So the first petrissage stroke that I want to do is palmar kneading. Okay, so as it suggests, it uses the palm of our hand. And in this case, remember what it does, it's more squeezing. Remember, with petrissage, we're squeezing, we're stretching. So and we're going more, so far we've just went longitudinally. Now we're starting to do a little bit of transverse. Okay, so I'm basically grabbing that and squeezing and going transversely off the muscle. If I wanted to do the inside, I would use the other hand. So this is palmar kneading, so I'm basically following that route there. Okay, I'm using palmar kneading, squeezing the muscle, stretching the muscle, kneading the muscle. This is what you do with the old flour, and you're kneading your flour. Palmar kneading. Now, it's a wee bit hairy, so we'll do that. Remember, what do we break it up with then? We break it up with effleurage, remember? So we'd go back then to doing some effleurage strokes again. Effleurage strokes clears away any debris, pushing all the debris towards those popliteal nodes in the back of the knee. Back to doing some palmar kneading. Squeezing those tissues together. He's not liking that really, are you?
No, not really, no.
Back to doing some effleurage. So the next one on the list is knuckle kneading. So as it suggests, we're using the knuckles this time. You can see the desired effect there of erythema coming up. Okay. Knuckle kneading. Okay, back to doing some effleurage. Next one on the list is fingertip. So we're going to use our fingertips. Now, we're running through just an arrangement of different types of kneading. You use the most appropriate applicator for the area that we're going. So more specific areas perhaps would be fingertip kneading. Larger areas would be more palmar kneading. Get the idea? Then we move on to thumb kneading. So thumb, remember about thumbs and digits, we always protect them. What we don't want is hyperextension of that thumb, leads to OA of the first trapezio metacarpal, okay? So, OA, yep.
What's that?
Oh, sorry, it's osteoarthritis. Okay, so thumb kneading, protect the thumb, and it's the same again, so we're just doing that transverse stroke, but we're protecting that thumb from hyperextension. And as I say, during our palpatory bit, during effleurage, we might have identified a little area of tightness or whatever, so I am doing some specific thumb kneading in that area. Okay, so it's for little pinpoint, more specific areas. Okay.
What have you done in case of that? So when you're feeling it, what do you, and what does that physically feel like?
Well, you might feel an area of tightness, or drag against the skin, or you might feel some like nodules, and all those different sort of ways the skin presents, or the tissue, the underlying tissue. Okay, so if you want to work specifically, you decrease the size of the tool. Picking up is when we're separating the deep layers from the superficial areas, or from the deep layers from the superficial layers. So with the leg of a calf, you maybe just need to use on the size of the calf, you would just lift and let it melt through the fingers. Okay, so separating, you can give it a little shake as you go along, so just picking up the deep layers and letting them feed through the fingers to the superficial layers. If it was a bigger muscle mass, like the hamstring or the thigh, you might have to use your hands and let it. So that's picking up. Okay? Compressions, again, FLIs in between. Compressions are simply what you're doing is you're applying pressure, but never apply a pressure over a joint. Apply pressure. So what we're doing is, remember, nice arms close to the body. Pressure down, hold that pressure for 30 seconds or so. And what you're doing is emptying the venous beds. You're squeezing everything out. Squeeze it all out. And let it rush back in. Okay, so you're squeezing it out. And you're letting it rush back in. Okay, so that's compressions. And that is, guys, is an arrangement of petrissage techniques.